orientation. Okay, so this is a orientation for the Mrcpch clinical exam, okay? And we're going to discuss what you need to study and how to study and the duration of study period. So number one, we have 10 stations. We have 4 clinicals with the patient, and you have history taking station, 2 communication, 2 videos, and 1 development. Up till now, the development is without a patient, but you never know when it will go back. So basically now the clinicals have changed from previous year. Otherwise, development is still the same. History, communication, video are all the same, whether with the patient or without the patient. So currently, these are the 9 clinical domains. How they give you the marks in these 10 stations is based on this. So not all stations except for development actually, that will have all the full marks. 6 clinical domains will be there, and 6 into 2 is 12. So maximum you can get is in the development. After that, the maximum scoring station is the history, which is 10 marks. Okay, so it will be based on these domains. Not everybody will have information gathering, history taking, obviously. And the information sharing is also not in every case. Like a video, it won't be there. So it depends on the clinical domains how much marks are allotted. That's why currently the passing mark has been reduced to 60. Before it was 62, now it's 60. So that's good news. And number 2 thing is that the clinicals although have gone back to the patient, but the development is still without a patient. And I think it's quite convenient if you ask me. My personal opinion is that when it was with the patient, it was kind of not structured. If they keep it with the patient, it will be very difficult, to do the assessment. Like they might bring the patient in, but it's not like 100% sure. But if they do, it's more difficult than doing it with a virtual patient. So I think this is currently the best format possible. All right, so these are these clinical domains that I was talking to you about. Okay? 6 clinical domains: A1, B, C, D1, D2, and E1. So development will have all 6 of them, hence you'll have 12 marks. History won't have physical examination, so it has 10 marks, and so on. Okay. So let's go and see. For all stations, you outside the station, you have 4 minutes. Now in the clinicals, you don't know what you're going to get inside. However, in the history station, in the communication, in your video, and also in the development, you will have some idea what's coming inside, right? But in the clinicals, those 4 minutes are just, nothing there. So after those 4 minutes, you enter the station, your time starts. Even before the bell rings and the time has started. So you greet the examiner, give your right mark sheet, arrange your mark sheets according to the sequence of your exam, and then you will proceed towards whichever station according to your circuit. They will give you a circuit outside before your exam starts. So arrange your mark sheet according to your circuit. Don't make it the wrong arrangement and you give the wrong mark sheet, it will be a big problem. So history taking station, your aim for history, they want us to take a focused history, okay? And you should be able to pick up the important points when you summarize so that you can identify not only the medical but also the non-medical. They give a lot of importance to social problems in the Mrcpch clinical. So I keep on telling everybody in the last 4 minutes, if you have not taken the social history, you must take the social history. Otherwise, if you leave the social history, you might be actually leaving a very major issue and the examiner will definitely bring it up. Okay. Nowadays, I've taken a lot of feedbacks recent ones in which it was said that is a single mother, and these are like social problems, isn't it? So we cannot ignore the, just focus on the medical issue and not the social issues. Because when you are going to talk about the management of the patient, it will be a holistic approach. You will talk about, obviously, that you refer for the medical issues to the specialist, subspecialist, but for the social issues, you have to say, I'll involve the social worker, get her some care support. These things also the examiner wants to hear. So you cannot ignore the social history. This is important, especially in development also, not just the history taking, but also in the development. Okay, although you have a very targeted history in the development, but you have to ask about the social history. Okay, the task, as I said, will be given to you outside. So you have 4 minutes to think about possible differentials, write them down, and take a targeted history based on these differentials. You should be able to, get a good idea what possible diagnosis can it be. If you go there without making a differential, it will be, haphazard, and you'll be asking irrelevant questions. You don't want that to happen. For targeted history, you need to make differentials before you go inside the history taking, and you should then go ahead and cut them down. Now, by the time you've taken the history, the examiner is going to ask you to present the history. Number two, he's going to ask you what's the differential. So if you have a list of differentials from before, you can easily say, okay, it's most likely it's this, but it could be this, but he did not have this. And secondly, third, it could be this, but he did not have that. So you have to exclude all the second, third, fourth, in decreasing priority order. Okay. That's the only way to do a good history, that you go in with your differentials. Otherwise, you'll be asking random questions, and the examiner can feel it. So you're not asking relevant questions, and they'll say she was asking irrelevant questions. All right, so you have to understand the history will be either with a parent or a teenager. Teenagers are coming a lot nowadays in the communication and history taking. They're not difficult teenagers in the history, but in communication they can be. So you have to definitely, talk nicely with the teenager. Why? Because they don't like to open up, right? So it's not like the mother, she'll tell you most of the problems she's having. The teenager might hide things. So you have to be very careful how you talk to a teenager. You have to make them feel, that they can trust you, and, make something clear to them that, whatever we will discuss today, it won't be, disclosed unless it will harm your health or anything. Same in the communication. You should always make this kind of statement, especially when you're going to ask about the heads. I hope you all have heard about the heads. It's basically the home environment, the education, activities, drugs, and other three S's, sexual activity of the child, and these. So these are very private questions. So don't interrupt the mother, okay? This is very important, that in the communication or history, you have to make sure you don't interrupt the mother. Let's continue. Sorry for the interruption. So communication style will also be checked in your history taking, not only in the communication, but also in the history taking. Don't think it's only you have to make rapport and show empathy in the communication, you have to also do it in your history taking station. So number one, always try to open your history with open-ended questions. What do I mean by open-ended question? That you will ask them, can you please tell me about more about the headache? Don't ask when does this headache come, what kind of headache is it. Those are close-ended questions. First ask how to describe the headache, then ask the specific questions related to the headache. Okay, is that clear? Then you will proceed towards asking about um, all the history. Okay, you cannot leave any headline of the history, because this is your history station. When we say focused history, it doesn't mean, okay, he's a 14-year-old, what's the need for me to ask about birth history? No, you need to ask about the birth history. Suppose there was something significant there, or I don't need to ask about his development. He's going to school. He must be fine. No, you have to ask. Okay, you cannot leave any headlines. And systemic review is something everybody leaves and they don't do it properly. I know there's a issue of time management in the history taking, but you have to practice for that. Okay, the only way I conquered the history, time management issue is by practice, and that's what I'm telling you to do as well. Right. So go ahead and ask in full, details of all the important positive things that come up in the history. And if it's like an older child, you can just touch on the birth history during his pregnancy or after that. Was there any problems? If she says no, then move on. I don't need to go into it more deeply. Like, was he jaundiced and all that? Did he pass meconium? Unnecessary details you don't need to do. Okay, but suppose it's a child who has developmental delay and he's 14, then yeah, you have to definitely take a more deeper history. It varies from patient to patient. You have to, use your common sense. All right, so you always have to remember whether you are in the clinical or any other station, except for the video when there's no patient. You have to understand, you have to show empathy, okay, with the role player or with the child. You have to show empathy and be nice, be gentle. Don't think your main agenda has to be fulfilled. Always the patient will come first. Okay, if the patient is refusing examination, for example, you can't force him to be examined. Okay, so these things in the role player also, if he's being very rude to you, you have to, keep your composure and shouting or something. This is actually, they've been instructed to see how you react, and if you don't do it properly, obviously communication and is mainly done for them to see how you communicate. They're not checking your knowledge as much as they're checking your communication skills. Okay, so that doesn't mean you have to have perfect English or anything. It's how you do it, like your body language, non-verbal, cues and all that. So this is what you need to do in the history. They're saying if you can explore the problem, can take summarize the information that you got from the mother in a proper, nice manner, and you make the differential, and also you need to do the management properly. Okay, what people do the minute the examiner asks, how will you manage? Immediately they'll jump to the investigations. Why are you jumping to the investigations? If a child comes to you, you take the history from the mother, then you'll examine the patient, right? So go stepwise, decide does he need admission or not. Okay, these basic steps must be fulfilled. Then go for the investigations. Don't jump to the directly to the investigations. Okay, say I'd like to examine the child first. If he's got any, he's unstable, for example, I'll stabilize him. Then I'll examine him thoroughly, and then do investigations. Involving my senior. Don't jump to the investigations. And management and treatment. The thing about the history station, it happened in my exam also, that they don't stick to the history that you just asked about. They'll ask about the differentials. Maybe they'll ask the treatment of the differentials. Maybe they just leave that history behind and go into something else completely. This is the only station this can happen. And it happened with me as well. He asked about all the differentials. How will I detect the child has non-accidental injury? Although it was not a case of non-accidental injury, but he was asking me about that. So this is the only station it can happen. Other stations like clinical videos and your development, it will be all about that case and that patient. But yeah, in the history station, they can go anywhere. Even in the videos, they are doing this nowadays. If you ask me, they sometimes do ask about the differentials. Okay. So this is the thing. I mean, you should be prepared for that. That's why you should have a good list of differentials. You cannot pass this exam without 3-4 things. Okay, one, you can't pass without proper time management, and that will only come with practice. Number two, you have to have some idea how to give the exam, meaning the technique of the exam. You can't pass without it. I mean, I can frankly tell you that people have passed without courses. That's because they've been hearing meetings and stuff like that. But you need somebody to tell you that this is how to give the exam. Otherwise, you can't do it, because it's not like other regular exams. You have to do it according to the structure of the exam. Otherwise, you can't get the marks. Okay, and you have to be very good at differentials as well. Another important thing in all the stations is your differential diagnosis. Except for the communication, it comes everywhere. Okay. So yeah, this is the history station. Let's go to the next one. Communication. This is actually, I think it's possibly one of the easy stations if you look at it, because they don't really want to test your knowledge. If you don't know something, you can get away with it. But if you don't communicate well, then you have to work on your communication skills, because otherwise you won't be able to get through. And for that, again, you have to have a proper structure, how you introduce yourself and how you talk to the mother. These things will come with only practice. So again, the word, you have to practice to develop good communication skills. And I would suggest you practice, especially all the recent exam scenarios. If you don't do them, definitely they will come from the recent exam scenarios, past 2 year scenarios, or they might give you a new scenario as well. But if you're well practiced, you can do the new scenario as well. Okay, communication, they will introduce new scenarios from time to time. So it's not necessary if you practice 100 or 200 scenarios in the exam, you might get both scenarios which you've never seen before. It has happened in one exam, I remember. Both scenarios were completely new and they were very technical. One was a dengue fever, how to, with a medical student, not even with the mother. Like explain to the medical student pathophysiology of thrombocytopenia in dengue fever. And the other one was the critical incident of haloperidol. Can you imagine getting both scenarios new in your exam? So if you know how to handle these scenarios, you can just fill in the blank of your structure and you can easily do it. But you need to know about the type of scenario it is and how to do it. Only then you can do it. And that's why you need to know the basics. So this is how they'll give the scenario. However, in the exam recently, they've given very, very long scenarios, and it's become very difficult to read all of it. So what I have been telling my candidates is that you have to read the task first, then you have to read the whole scenario, because they're giving really long scenarios, really, really long. And they take like 3 to 4 minutes just to read. Hence, you must read the task first. Okay. And these are the 6 type of scenarios. But actually, I have made a 7th type. Currently, I'm not going to talk about that. There are 6 official scenarios, but there's a 7th type I have made, because in that we will break all the rules of the communication. Normally, we're not supposed to do history taking. We're not supposed to, always, almost in all cases, we do ask for the attender. But in these 7 scenario type, that I say, we do not do these things. We do not call in a tender. We do not, we do take a history, some few questions of history, and we do not attempt to draw for that, those people. But these scenarios, these are the patented ones. And in here, you can ask for the role player, do you want an attender? And you try to avoid taking any history, okay? And you can draw also. Maybe in the critical incident, you might not want to draw. She'll be an angry mother, but yeah. So empathy is very important, and it's not common. Many people have empathy, not because they don't have it, but because they're focusing on the information so much. So their empathetic part of the brain turns off. They'll be good role players, but they're not able to act like in their as a candidate. So you need to learn to act as a candidate as well, meaning you pretend that this is a real mother and you have to give her empathy. Okay. So don't give a lecture in the communication one way. Your child has this and he can develop these problems and we'll do this, and let the mother ask you questions. And the only way you will let her ask is by stopping talk. Talking is going to be detrimental for your communication, because if you keep on talking, they can't ask you questions. And they will not interrupt you. Some of them will, but some of them will let you talk and talk and talk. And if you're that type of person, then it will be really bad. So it should not be a lecture, and you should always remember, if you got a teenager or a junior colleague, don't be patronizing, okay? And avoid asking questions, as I said, from the mother. We don't take history and we don't ask her questions to test her or anything. And we try to obviously avoid jargon or inappropriate language, okay? And you have to remember that if the mother is angry, never ever tell her to, that you need to calm down or keep calm, please, or something like that. It's her right to be angry, or if she's worried, don't be angry, please. We are here to support you. No, you never tell her that these words, okay? You can say, I understand that you are upset and it's your right to be upset. It should not have happened, this mistake. Again, I apologize on behalf of my team for this error, and we are looking into it, and like that. You have to be very, very, careful with your words. If you say things like calm down, it's going to add fuel to the fire, and she'll get very angry. Okay, she'll say, how can you say calm down, doctor? And instead of calming down, she'll erupt even more. So as I said, you have to learn how to start the communication well, have appropriate body language. Don't listen to the mother, make it a dialogue. Don't make it a monologue or a lecture. They're telling the mother, this is a disease and this is what we're going to do. This is what happens, when you have too much information in your head. You say, I have to deliver this information. Actually, that's wrong. You have to wait for the mother and see what she wants to know, okay? You have an agenda too. It's not like you don't have a task. But you have to wait for the mother also. She's the number one priority, not your task, okay? You can, if she keeps on, if you ignore her questions, you cannot pass the station, okay? You must never ignore the role player, okay? Even if she asks silly questions, you still have to answer them. And if she asks till the end and you're not able to summarize, it's fine. Your summary is not important, but you have to satisfy the role player. Many people I've taken feedbacks from have not been able to summarize, and they got full marks. So it's not like summary is essential to get full marks. But if you don't answer, ignore the role player or act like you dismissed her question, that's lethal. I don't recommend you do that anytime. Okay, so the video stations, these are very, it's a pretty, easy scoring station, but it's not easy to conquer. You have to need a lot of practice, and you have to be familiar with all the recent exam videos and also like past videos as well. I'm going to tell you this for sure, that people have messed up simplest videos. There is no such thing as an easy video, okay, for number one. And it can get really complicated depending on the examiner as well. I mean, there's no hard and fast rule that any video is simple. So you have to be really thoroughly prepared for the video. It's a like a completely new thing for people who've given other postgraduate exams. So you have to be preparing for the video scenarios really well, because there's a limited time and you have to know every step of the video questioning. There are 6 questions. One, they'll ask you, what have you seen in the clinical video, the findings of the video. Number 2, they'll ask you what history you'll ask the mother. Number 3, what examination you'll do. And then they'll ask you, what is your differential diagnosis? Then they'll ask you, okay, this is the diagnosis. If, for example, you give the wrong differentials, now he's going to tell you, this is the diagnosis. Now tell me how you're going to investigate and manage. So this means you will get the diagnosis within the exam. Whether you're right or wrong, you'll find out immediately. But this also means that if you are able to give the management and investigations, you can get some marks in the video, okay? But unfortunately, this is the reality of the situation. Despite people saying, describing the video well or other things, they still get a 0 in videos, okay? So basically, the reason they get a 0, it could be multiple reasons, but I cannot discuss all of them here. But this shows it's a predictable scenario, and people can mess it up still. So and it's 6 marks. Two videos are 12 marks. So there is still a lot of marks going down the drain. If you get 0 in one, maybe this is how you will fail. Okay. You cannot risk getting 0 in any station, and video station getting a 0 in it is a kind of like it's a sorry state. I mean, because you can easily predict them. Suppose it's a new video that you're not familiar with, I can understand, but most of them are predictable, so you cannot mess it up. This is the most predictable thing, in the whole stations. You might say the common scenarios keep on repeating itself. So you just can't mess it up. Because I'm telling you, clinicals are the most unpredictable. People with the best clinical skills can still mess it up. They might miss a finding. But videos are like, you find out from other people what comes in the video. How can you mess it up? You have to prepare for the exam, and that's the reason. If you didn't prepare, then you messed it up. So you also need to, form groups for practice, and ideally it should be big group practice. But nowadays, I don't think there are any meetings that are happening, which in my time, there were really nice people who used to do big meetings, and we benefited. I think the meetings are places where you practice, okay? Courses, of course, even my course, I do practice sessions, but you can't practice every single video, right, with your candidate. Even in the mocks, it's not possible that I cover all the videos. So the only way you can do it is you have to make groups and you have to practice. And one of my candidates told me this, that the video she did or the scenario she did, she was pretty confident in and was able to do really well. She passed, of course, but and with really good marks from the UK. But her, personal experience was, I didn't do that video, so I wasn't too confident in it. So that made my, brain register this tip from her, that you have to practice all the videos, okay? This doesn't mean you're going to passively listen in the course, or, my candidates are here, that's why I'm saying this. So don't passively listen. It's not going to be the same thing. If you've done this scenario in the exam, you can do it. And I'm telling you from my own personal experience, the scenario I got in my exam was evidence-based medicine, okay? It's a very tough scenario. You have to draw a lot of diagrams as well. So I actually did that first time in an open meeting without knowing a word about it. So and then of course I repeated it. It was not like the first time I did it and then I did it in the exam. I repeated it. but because of so many practice sessions, it was, completely in my subconscious. Even I hadn't revised for it, but it came the exam and I was able to do it because of the fact I had done it so many times. So unless you do it, you will never be able to do it in the exam in the same way. It's not the same thing. And that's the reason my course is this long, 6.5 months. To think that 6.5 months, it's a bit, people are doing courses like 3 months and they go at the speed of the wind, and you hardly are able to absorb. And like you should have time to absorb as well, right? But yeah, some people don't even practice in their courses that much. So this is the reason when I made the course, I said, what the things I had deficient in my courses, I will not let that happen. Of course, nobody's course is always perfect. Even mine isn't. But yeah, I mean, I prefer to take feedbacks. That's the reason, to improve the course. And I like positive criticism, and I encourage that. But anyhow, this is the main advice I'm going to say, that you have to practice, whether you do it in a course or not. But remember this, people are there who are misguiding you. And I have anonymously heard things, like, I'm not going to say what exactly, because that might also be an indication. But people say things which are absolutely wrong in meetings, and also sometimes dangerous stuff that should never be done in the exam. So literally I cannot say anything because everybody will recognize me. So I normally don't talk about it. But I've seen like dangerous things being told that you should do this in the examination, and it's forbidden. You should never do that in that exam. So if you do it and the child hurts himself, you'll fail. So yeah, better be careful who's guiding you. Okay, this is what I meant. If the person has passed the exam, it doesn't mean he or she is capable of guiding you. The person has to be well experienced, and also you should see the how many people have passed through them, and this is very important. Okay, people are always saying like the past the amount of people that have passed, but it's the past percentage which is the most important. Not just I used to take this easy, but it's the reality of the situation. How many people pass out of how many people gave the exam? That counts. If the majority are passing, then that's an effective course, isn't it? Not rather like if 10 people pass out of 50. So that's not really that effective, if you ask me. All right, so the examination is very important. You have to introduce yourself, wash your hands. Don't forget to do that. People are forgetting to do these things. Okay, that's what I'm telling you. And then take consent, of course, from the child if he's older. And then you'll go make some rapport. Rapport is very important. People are forgetting rapport. I keep on telling them in the mocks as well. So you have to maintain the privacy of the patient. Be gentle. Ask about pain before you touch them. It sounds very basic, but people forget to do that. Okay, and yeah, you should make a template for each of your system so you don't forget anything, and you need to practice according to your template. Okay, by the time you give the exam, you should not be thinking what I need to do next. Okay, the problem with people are that they're so even verbal exam, when I do the online thing, they're still messing it up. So imagine what can happen if they do it on the patient. I prefer they do an open camera mock with me, but not everybody is open to that. But I've seen people mess up even verbal examination. So it's like you have to learn how to examine properly. This is the most important part. Then you have to know all the basic cases that come in the exam, the common cases, especially according to your center. This is very important. Your center matters. Okay. If you're going to the UK, for example, the cases are different from the Middle East. And if you're going to Pakistan, it's completely different. So you can't expect to pass in the UK if you're not oriented with the UK cases. Okay. All right, so time management, as I said, is one of the Very important things without which you cannot pass. The whole exam is about time management and being organized. If you are not organized and you're unsystematic, they're obsessed with this word systematic approach. You'll see it everywhere in the Mrcpch, things. You have to have a systematic approach, and for that you need practice again. So present your clinical findings in a very succinct manner. The examiner is impatient. He's got only 3 minutes, okay? And he wants your presentation, your differential diagnosis, your investigations, and management, and all that in 3 minutes. So if you're gonna start saying the child is not clubbed, his pulse rate is 150, he's not gonna be happy. Okay, you have to just learn to finish your examination early either, or you must be very fast in your presentation and do it very important points. You have to not forget the important negative findings and also the positive. Of course, you have to say. Like important negative finding, for example, there's no scar mark. If you don't mention that, how will he know that you even look for the scar? We're not allowed to do running commentary, okay? So you must have differentials. As I said, the most important thing in the whole exam after time management is your differential diagnosis. And of course, you must know other things as well. Sometimes after investigations management, they might ask what advice you want to give to the mother, what complications the child can have. These are pretty much patent questions other than investigations and management. Development is basically 4 areas. They can give you double task or single task. So either you have gross motor, or you have fine motor, or you have speech. These are the single tasks. Or they give you fine and gross motor together as motor skills, or they give you speech and social together. Social never comes on its own, okay? The rest, all three can. So currently it's 22 minutes. They've decreased the history time to 9 minutes, your presentation to 1 minute, and you have 9 minutes for the assessment, and then 3 minutes to discussion with the examiner. So total of 22 minutes. You have toys in the exam. It won't be this picture. So forget this picture. But yeah, you will see something like the toy like this. So in the development station, you have to understand that this will be any age. Actually, it's not just 5 years, because now the patient is not back, but at our time we used to have small children. But this is like the pre-COVID webinar of the Mrcpch that I've got these slides from. However, the history taking is the same, right? So you have to ask about the etiology, perinatal. You have to find out the etiology actually from the history, why the child is delayed, and what is the pathophysiology. All the differentials you'll get from the history taking, and also social history. If you remember, I told you social is very important. So starting from your birth history, any chronic medical problem the child has, and also any family history for any disorders. Don't forget these things. Here you'll get the etiology. Okay, so you have to remember the comorbidities as well. Like if you have an ADHD, autism kid, ADHD has to be ruled out, epilepsy has to be ruled out, and then you have to see, of course, as I said, difficulties in the social life, income, any care support the parents need. So you have to understand what the child is going through. Okay, any treatment he's receiving, is he responding to the treatment or not, and also about his schooling. So this is your 10 stations, okay? And now I'm gonna go to your important things, that what books you need to read. Okay, so starting with Mrcpch, this is your Bible. You can cover clinical from here mainly, history taking, communication also, and a bit of development. But mainly clinical is very good here, okay? But you need to do all the histories, all the communication given here, and you need to read this book, okay? Rebecca is, the scenarios are valid. However, the information may be outdated, so you need to update yourself. You must practice all the scenarios of Rebecca, okay, for your communication skills and also your previous exam scenarios. So this will be enough. You don't need any other thing actually. Then nice guidelines actually are a lot in detail. So read from the pediatric neonatal guidelines, take out the printout, don't depend on a soft copy. And this is my favorite book for history taking, Essential Clinical Skills in Pediatrics, and Khidr sheet also. Okay, Khidr for history is very good. So development, also Khidr I like because that's what I study from. Dr. Muntasir also has good books. I'm not going to say that because I mean, both of them are pretty nice people. They made really nice notes. But this book has been recommended, this Child Development, an Illustrated Guide by Carolyn Meggett by the RCPCH. I don't have this book, but I've seen it on Google. It's a nice illustrated book. Then we have, this is my favorite book for clinicals, one of them at least, Mrcpch Clinical Made Simple. Also development is nicely given here. This is actually the best book I've ever found, I think. Clinical Pediatrics for postgraduate examination. It's very, very nice. Then we have short cases for the Mrcpch. Actually, all these books are nice, okay? There's no way I can say one is better than the other. These are short cases. Those are how to examine the clinical stations. Circuits actually are scenarios given for old exam format, but you can still use them to practice. My friends definitely use this to practice when they were giving the exam. I didn't have the time actually to do all these books. I did the Mrcpch Made Simple, Clinical Pediatrics, and short cases, but circuits, to be honest, I didn't go through. And other books came later, which I found very nice, but of course, I did not study from them because I didn't have the time and I didn't have them at that time. So these three books are also very good. The clinical examination skills in pediatrics, secrets to Mrcpc. This is a Malaysian book. There was one Malaysian candidate, she shared it in my group, and then it went viral. The secret to passing Mrcpch clinical exam. Then the Mrcpch clinical Go Pass is also a very nice, cute book. I used to read it before, I joined the courses. And this is Dr. Anil Garg's book. It's also pretty good. But these books will be all, first you have to go through Mrcpch and also go through the, one patent, like a Mrcpch Made Simple book or clinical pediatrics for postgraduates. Do 2 or 3 books. Don't engulf everything. This one, this book that I'm talking about, this has really good presentation skills. Okay, and try to do it. Dr. Mark Delzel, I think his name. So this one has a really good presentation skills, how to present. People have the most difficulty how to present. So you should get that book. And yes, for the differential diagnosis, Google is my favorite actually, but you can buy books. And for theoretical knowledge, you do have to have theoretical knowledge. When I say you don't have time, but actually you might need to do it. Because if you don't have a good basis of theory, you might fall in the history station, sometimes even in the videos of clinicals. So illustrated textbook of pediatrics and survival guide, they're pretty effective in covering your theory part. Then these are the websites. Rcpch, the site itself has many nice resources and a nice .org.uk and also NHS website, the patient info website. There are 2 types of patient info, and this is what I am always talking to my candidates about. The doctor page is where you get the medical information for the doctors, and the health info, this is the second type. This is non-jargon, okay? Ideal for communication. So other than your patient leaflets, which you can Google, put your diagnosis, developmental dysplasia of the hip plus patient leaflets, UK or NHS, you get really nice leaflets about that topic. So and then those are numerous, okay? But this one is also pretty good. I mean, I tell all my candidates to read these two and the guidelines and Mrcpch and a bit of Fither, and you can pass the exam with the course, of course. Okay, so yeah, there are other websites, Mrcpch, pediatrics.uk. This actually is a nice, and the PDFs are pretty good. Download them. Approaches are given, but the videos actually have mistakes in it. So just be careful. Don't follow them blindly, because those are trainees. They're not like consultants. They're nice enough to upload them, and but the written information is all nicely given. It's well corrected, and you can follow it. Geeky Medics has better videos for examination. Less, I've never seen any mistakes actually. So I prefer Geeky Medics for examination. Although it's for adults mainly, but they do have children part as well. Okay. And it doesn't matter, you can watch the adult videos for many of the examinations. And then online, this is for the musculoskeletal system. Very nice website for that. And then we have the gouache, the gouache I gave for the patient leaflets. They have a lot of good patient leaflets there. And actually many of them have, it's not only gouache, many of their trust hospitals have very nice leaflets. And then YouTube for the videos, okay? You need to see gates, you need to see producers, the cough of producers. People are always confusing Strider and producers, and they're messing it up. So you need to watch videos, okay? Of course, they won't be the same videos that come in the exam, but yeah, that's why you need to hear the feedbacks. When I do feedbacks, you people need to attend them, okay? Okay, so the other important things, as I said, previous exam cases, again, the feedbacks, and of course, the courses. You should join somebody who practices and is dedicated to making you pass, okay? And yeah, Wayne Harris I like that book actually, but many people find it difficult. So I would recommend not going through all of it. Just, looking at the tables or something, or extracting information from it. Nelson, no, I don't like Nelson personally. And I will never recommend it for Mrcpch, because it's not, the theoretical part you can follow. I'm not saying that, but the management, no. The past test, no. I meant the past test clinical, it's kind of outdated now. So the course is not to be taken. I took it myself. I found it useful. I'm not going to say it's not useful. The communication part was a bit nice, but actually, I mean, it's you. If you look at it, the history taking was completely not, what happens in our exam, and other things also. I mean, overall, I found it not that useful. So your top tips for preparation for the clinical exam. I've already done a tip session with my candidates, but I'm gonna just tell you a bit. This is like a game. You have to learn how to give the exam, okay? Without knowledge, of course you cannot pass, but without the technique, you will definitely not pass if you don't know how to do the exam in the way they want you to do it. Like communication is not like you go sit there and talk to them and just leave. You have to know the exact way how to start and stop a communication. So you have to learn to talk. That's what I mean. And how to deal with the patient, show the empathy. And it's always, remember, the patient always will come first. You can't ever hurt the patient in the examination and be, rude or patronizing in your history taking or communication. So always be nice, friendly, and non-judgmental. Okay, and always remember the social and the impact on the family. Okay, this is very important. If you don't ask about the impact on the family, again, the examiner will not like it. Learn time management. I've already said that. Make your templates. Template actually not only for the clinicals but also for your history taking. So you have a systematic type of history, systematic type of examination, and also systematic presentation as well. So you have to learn how to pick out your positive findings, how to say them, and relevant negative findings. And also remember, in a clinical exam, you won't be able to do all the full examination of the patient. So you must be able to say, I'd like to complete the examination by doing this. Okay. The only problem is the examiner doesn't have the patience to listen to that. And as I said, the only way you can do that is by finishing your examination early. Okay. So collect and learn all these materials I've told you. Okay. Don't collect too many books. It's a very bad idea. If you have too many books, you will be going haywire. So if somebody is there to teach you, it will be good, because then you know, one thing is that the person will be able to correct you. Okay. You need someone to tone you down and fine tune you. That's what I would say. Fine tune you, because you might know more than me, but the whole thing is about fine tuning. Okay. The knowledge, as I said, matters with secondary. If you don't know the technique and how to give the exam, and I, obviously we're all learning in our whole lives, so it's not like everybody's perfect. But I've literally, I'm telling you, I'm still fine tuning my course. It's been 3 years, and all the time I'm adjusting it, because one, the format keeps on changing. Every time the format changes, I have to change my course. So I've changed it so many times, and currently I think I have kind of perfected it in some areas. But one area I think I have to do is that maybe I have to make it a shorter course and faster course. So that part I'm going to work on, because I think 6.5 months is a bit too long. Maybe you know, because I felt, you know, the candidates, they get a bit tired at the end. So those who are dedicated, I'm not going to ever say they will find it tiring, but there are people who are dedicated enough to attend the whole course. But I felt, you know, there's a bit of compliance issues with the people who have little patience and want the seat immediately. If they don't get it, then they become non-compliant. And when they get a seat, then they come to me and say, I've got a seat, so what can I do? So that is not my fault, isn't it? If you don't attend the course, is it my fault? Anyhow, so practice, practice, practice. Use any opportunity to practice. Practice it with as many people as you can. This is what I did, and I'm recommending it to you. So practice also as a role player, as an examiner, not only the candidate. And also you should you know, be strict with the time. Okay, don't give extra time to your when the time ends, you in the exam, they won't give you any extra time. Okay, I'm pretty lenient because I want you to train properly first, to do it correctly first, then I tighten you up by the time you are ready for the exam. Okay, so study groups, you have to make large ones, small ones, both. Near the exam, small ones. When you're preparing, it should be a large study group. And this is what I recommend, though nobody's doing it nowadays, but that's their own priority. Anyhow, so no overconfidence in the exam. They don't want you to be overconfident doctors. This is not FCPS exam. They want you to be underconfident, but not underconfident exactly. It should be, they want you to be confident but not overconfident. I think that's the right word, because overconfident means I'll do this, I'll do that. You know, you're not going to do anything. You're just an ST4. You're going to refer to the specialist. He will decide what's the treatment. However, you can say that this is the I will refer you to the specialist, and these are the options for treatment, but he will decide. This is how you're supposed to do it. So you know the treatment. It's not like you're not supposed to say anything, but you will say that it's not I'm not the one who will decide the treatment. It's a specialist who will decide. So you always have to show your limitation, and this is what the examiner wants. If you don't know something, do not pretend you know about it. If you say, I don't know something in your communication, you can get away with it and say, I'll find out and let you know. It's fine. But if you say the wrong thing, they won't forgive you. They'll cut your marks. So please do not act, you know, don't try to pretend you know everything. Okay. Okay. So they want you to be basically safe doctors. So whether in your history taking or in your communication or anywhere else that matters, you have to rule out the red flags. Okay. Do not, as I said, don't say these things. Okay. Don't say differentials that you don't know nothing about. Some weird inborn error metabolism as a differential. Okay. Please stay with the common things, okay? The examiner doesn't want to hear hi-fi diagnosis, okay? And try to be down to earth and basics first, okay? And if you try to show off, I'm telling you from my feedbacks, I'm going to tell you this because I've taken feedbacks from my candidates and occasionally from people nice enough to give me feedbacks, you know, who are not my candidates. So basically, people who talk too much in the exam, I'm telling you, they don't fare well. Okay, this is what I've noticed, and this my own candidates have told me this. You should not talk too much. I've uploaded some things on the Facebook, not on the WhatsApp, so you'll have to join the Facebook to find out. Anyhow, so that person also said the same thing. Don't talk too much. You talk too much, you might say something which is wrong, and the examiner actually doesn't like you talking, and all that. Okay, sometimes I say in the history taking, you might be able to talk more, but in other stations, please do not talk a lot. But yeah, so this is very important. You have to be careful not to argue with the examiner. If he's giving you some hint, maybe he's testing your confidence, but it could be also that you're mistaken and he's trying to guide you, prompt you to the right diagnosis. Okay, and please do not lie, do not make up findings. This is, I think, if you heard feedbacks that this has happened with somebody. I mean, not in the exam, of course, thank God, but somewhere else, and she learned from her mistake. So I'm telling this, this actually does happen. I mean, I could not ever think that it's possible, but people do make up findings just to fit in the diagnosis, okay? Do not ever do that because they know the findings of the patient. And if you make up any finding, they will not forgive it. Just like wrong information, it's unforgivable, okay? So if you have something incorrect and you should admit your mistake and correct yourself. Okay, do not say redundant words that everyone else uses. Okay, like in the communication, people are saying, how's your journey to the hospital? And sorry for that. So empathy, you can find some new words and so something new words for the rapport, you know, in the beginning. I preferably like ask very simple rapport, no? Nothing complicated. Like, how's your journey to the hospital? What if the mother was admitted 3 days back? It doesn't make any sense asking about the journey to the hospital every time. So please use some common sense, and it's you can easily make up your own rapport. So don't be boring. Examiners actually make fun of these things, you know, it does happen. So obviously they keep on hearing it. Even I get irritated every time somebody says sorry for that, sorry for that. Please, you know, I must be very distressing for you, and that kind of thing. You can add some new words for God's sake. Okay, so yeah, patience is very important in this exam. People who are impatient, I mean, you have to work hard and you have to wait for your seat. So impatience will not work. In fact, this exam will ultimately teach you patience. This is what I should say. If you were impatient, by the time you'll pass this exam, it will tone you down. So persistence and practice and preparation. Preparation, ideally, the way you should prepare is by this learning pyramid, okay? Lectures are important, but more important that you should also be actively reading, learning, and also discussing, and also teaching others. Why don't you also do meetings and teach people? Okay, this is how I started it, and that's how I ended up making the course, because my friend said, you're teaching, why don't you make a course? So I wasn't interested actually, but my own course coordinator is the first person who suggested it, and then my friend suggested it. I was not interested at all. And trust me, it is a very, very hard job. I used to think, I knew it was a hard job, but I currently understand how hard it is. Because one, you have to be always on top of your game. The exam is a dynamic process. It's changing every time. So if you're not on top of the game, then yeah, you can't really guide people properly. All right, so currently I have two courses, one 6.5 months, one is a short course. And I'm not gonna talk about the courses now, leave that. But if you're interested, you can contact me on my number. And if you have any questions now, you can ask. Let me stop the recording.